All right, good morning and welcome to our every other week press conference. I'm joined today here by Dr. Bill Remington from the Kosciuszko County Department of Health, as well as Kirk Carlson from Bowen Center, our testing site. Got a lot of information today, a lot to talk about. Typically on Wednesdays is when the state updates their map at noon, and we will be watching that. We're guardedly optimistic we won't go red, but that won't be official until noon, and we'll wait and see what happens there. So the only other thing I wanted to just mention is that I know Thanksgiving is a very important time for families. I know many families are cutting back on their plans, their travel, their gathering sizes, and no one likes that to happen. I've also, though, seen and heard a lot of people getting a little bit creative with virtual events and that type of thing, and I know you can't smell the turkey over the computer, but it really is important that as we are just seeing these significant rises, that we try and cut back on that, and that's one way we can all help. Obviously, wearing a mask is becoming even more critical. There was just a new study out this morning indicating that it's a 70% less chance of contracting the virus if you're wearing a mask and the people around you are wearing a mask. Kind of goes along with what CDC had in their report a couple weeks ago, their literature review. So with that being said, I'm going to turn it over to Dr. Remington to give us the update from the Kosciuszko County Department of Health.
Well, thank you, Mayor. Just quickly, as I'm sure most of our listeners are aware, the numbers in Kosciuszko County are really high. We're up over 4,000 cases. Now, it took 3 months to get to our 1,000th case, and here, 2-3 months after that, we're up over 4,500 cases, 39 deaths, and condolences to those of you who have felt this. I think it's fair to say, based on conversations that I personally am having, this is no longer theoretical to a growing number of you. You're feeling it, it's palpable, you have anecdotal experiences of your own or loved ones. It's a real deal. The hospitals are seeing a pushed capacity, particularly in Elkhart and St. Joe counties near us. Allen County, the hospitals are being pushed. Care is being diverted in some of those venues. Elective or semi-elective procedures are being pushed back. They really are asking for our help. Testing is a challenge. With the surge of cases, there's a surge of demand and interest for testing. Capacity is being pushed. I'm so thankful that the Bowen Health Clinic testing site is up and running, and we'll hear from Mr. Carlson here soon. But without it, I'd hate to see where we would be at this point in the community. They're testing hundreds a day. Despite that, you'll see long lines, and test results take a while. That is not the Bowen Center's testing site's fault. These big reference labs, and despite the Indiana State Department of Health putting together an Indiana testing network, which has been phenomenal, it's still swamping capacity. So test results are taking a while. So be patient. If I may ask, if you are just curious and want to see what your test is, please don't get in the line of cars for that. If you are symptomatic, certainly seek a test. If you consider yourself a close contact, get a test. For those of you creating institutional requirements for testing, I'd ask you to look real hard at that to see if you really need a test to allow somebody back in your particular jurisdiction. The governor's executive order is in play for us as a local health department. This county remains orange this week. I am just certain we're going to turn red here in a week or two. And heads up to those of you who have scheduled special seasonal events or large gatherings, the language is stronger speaking against those should we turn red. And we may engage with you in a different tone of voice, temperament, directive from the health department with your upcoming event. There are some positive things. Therapeutics, a monoclonal antibody cocktail from Regeneron looks promising and has had emergency use authorization. And they'll have thousands of doses available to outpatients. Again, how that'll flow, who will be offered that is not entirely clear just yet, but it looks good. Immunizations are a big deal. Please vaccinate now against influenza. Influenza activity is very low across the state of Indiana and across the country for that matter, but it's just around the corner. It's a seasonal event. You can count on it. Please get a vaccine now. COVID immunization is coming. Perhaps within the next 3 weeks, we will have some vaccine to frontline workers. Details are pending, but a lot of planning is in place. I want you to continue to think to smash COVID, social distancing, masking, avoiding crowds, staying home if sick, hand washing. All those things are strongly needed by all of us to try to slow the spread and decrease the demand and the fallout at our healthcare institutions and perhaps save some lives. Thanksgiving holiday is looming large. Personally, we canceled some beloved family gatherings. Hate to do that. I'm not demanding that all of you do that. That's each of you to make a decision. Think in terms of social bubbles and how this spreads. It's a respiratory pathogen. Masking makes a difference. Social distancing makes a difference. Hand washing makes a difference. Limiting the size of your gathering and perhaps the duration of a sizable gathering indoors makes a big difference. The more people, the longer you're together, masked down, eating is a big deal. That's how this is getting spread. One of the ways it's being spread. Think in terms of this. How can I prevent becoming a contact? Nobody wants that phone call from a contact tracer that says you've been identified as a close contact. We need to take you out of circulation with a quarantine directive, which currently is 14 days. Nobody wants to miss work like that, be removed from other social gatherings coming up. So in the front of your mind, think, how can I prevent from becoming a contact? Health Department is poised to offer a little stronger arm on the enforcement side. We have repositioned staff to be available to handle complaints for entities of concern to our constituency in the county, and we have more people that can go knock on a door, go through expectations for the business or the food establishment. Mostly in terms, honestly, of a educational piece. It does have some potential teeth in it should we need to do that, and that outline of how that would play will be handed to the businesses and food establishments that we hear about of concern. Ultimately, we can close businesses. There's a way to do that. It's not something we would relish. My goodness, so many businesses are feeling this economically. The last thing we would want to do is add to that. But we want to work with you. Please work with us should one of our staff from the health department enter your food establishment or business. Please engage with them and let them help you come to the right type of play during this COVID pandemic. We will get through this. Eventually, this will change and get better, but I'm afraid that we're looking at weeks of this, and the death rate, just to be honest with you, is really going to shoot up here in the next month. So, not to frighten people, I don't want to leave you with that, but please really respect this pandemic. It's really showing its teeth at this point. Thank you, Mayor.
All right. I know you'd mentioned enforcement as complaints are made, and I also I think during our previous discussion we talked a little bit about just doing some random checking. Is that happening?
Sure, we have. We've repositioned some staffing in the health department to just randomly enter a business. So it is complaint driven, but it also is a random selection of businesses where someone from the health department will go in and chat with people there and give them a handout regarding direction and expectations regarding all the things that we've been talking about.
Right, and I know our discussions have been that we want it to be an educational intervention and just, again, utilizing what the tools the state has given. Certainly, we don't want to go down that list and staying at the top of the list with, potentially just a verbal warning and or an educational, hey, this is what we need to do. This is what the governor says we need to do. This is what everyone is trying to comply with. I appreciate what the health department is doing. They're put in a very difficult position, and I think, though, that as you suggested earlier, with the number of cases, everybody knows somebody now. Everybody's been impacted and affected by it and understands the reality of it. It makes concern and anxiety a little bit higher and makes your job a little bit more difficult in the health department. And I just appreciate that we've kept a pretty steady hand. You're giving us a little bit of light at the end of the tunnel, if you will, with the potential for vaccine and some of the treatments that are occurring. I saw this morning, I think one of the vaccines could be approved as early as like the first or second week of December. So already looking at how that would roll out, there'll be a lot of information to come, and I think that's when we're all going to start feeling a little bit better about this thing. But in the meantime, certainly kudos to the health department for again, just trying to work with the businesses, make sure they understand the concerns, the public health concerns, and following the pecking order, if you will, of enforcement from what the state has given us. So thank you very much for that information. You also mentioned testing, and testing is becoming obviously a very high priority and a very I've seen the new lines. Kurt, let's pivot to Bowen Center's made a big change the last week or two to try and accommodate that rush. And I know you can't do anything about the lab turnaround time, but you're certainly doing a great job accommodating all those locally that need to get a test.
Thank you, Mayor. In the spirit of Thanksgiving, I really do want to thank directly Brad Jackson, Marcia McSherry, the Fair Board, Jeanette, who manages that, Mayor Tallmer, Bob Weaver, who really made it possible for us to have access to the shrine building on the fairgrounds. We were doing everything we could to keep our staff comfortable and warm in tents, and it just wasn't working. And so they, beginning of this week, we moved in, and Saturday actually built the drive-through garages, and Monday morning, 10 o'clock, we started testing out of there. It took them about 3 hours to smooth out the process, and by 1 o'clock, they were at peak efficiency. We finally figured out the logistics for the traffic because it was already beginning to spill onto Smith Street, and we knew that wasn't going to work, and so we've rerouted it. So I think we've worked out some of the logistical problems, got ourselves organized. And again, I really appreciate the support of the county and city government. For those of you who do not have the privilege of working with these folks, let me tell you, this is one privilege to be working in this county and in this city. We truly do have great political leadership. And on a personal note, again, much of my family have decided that it's better to be safe than to risk infecting others within the family. So all but one of my children and grandchildren are actually deciding to have Thanksgiving with only the family that occupy the household. So again, that's a sacrifice. I myself love to cook, and we usually have 2 Thanksgiving dinners from different branches of the family, and sometimes 3, and now I only get to make it for my wife and myself. But it's a worthwhile sacrifice for everybody to be safe. In terms of the testing numbers, we're finished our 6th week and in our 7th week now. The first week we were at 328 tests. Last week was 1,672 tests that were administered. And as I've mentioned before, one of the populations that are most at risk from this disease and have the least access to health care is the Hispanic population. And so most of the workforce that I have working exclusively at that site are bilingual, bicultural. And the population in Kosciuszko County is 7.88% Hispanic, and we're up to 12% of the persons being tested are Hispanic. So I think we're actually reaching that population. There are some days percentage of persons coming through who are Spanish speakers are much higher than that. And so what we're seeing this week as the weather has changed, there are slightly fewer people coming to the test site, and so the weather does have an impact when it's sunny and bright and fresh. Standing in line or sitting in your car in line for a half hour to at one time up to an hour and a half is doable. It's not as pleasant in this weather, I'm guessing. On a closing note, I wonder, I've heard Dr. Remington speak about his knowledge of the history, his study of the history of epidemics and pandemics, and I just wonder, I'm contemplating, what will history say about what we're doing? I mean, do we look back in a year or 5 years and say, we did the right thing, or we didn't do enough, or we overreacted? I don't think we're overreacting. I don't think it's going to go that direction. And I don't know if you have any thoughts. Again, for myself, running a 1,500 person business and serving between 30 and 40,000 patients, we're requiring people to wear masks. We are attending to the quarantine when necessary, and doing the COVID testing. And I hope when the vaccines come around, we're privileged to also be part of that solution. Because if you figure in some locations, they can schedule up to 6 people an hour for 8 hours in a day. That's only 48 people in a day. And if we have to get to 75% of the population vaccinated to get herd immunity, that's not going to happen in that model. I think we need to have an additional model of distribution of the vaccine. And so like our testing sites, like I say, doing almost 1,700 last week, that is a different model that I would contend might work better. So I don't know if you have any thoughts about history, Doc, or what history will say about us.
Yeah, history is certainly intriguing with pandemics. I would never say I'm an expert, but I do enjoy reading about some of them. Often our attention turns to the so-called Spanish influenza of a century ago. And one of the prevailing and durable teaching points of that is communities that did more fared better than those that were unwilling to do the clamping down kind of things. Philadelphia versus St. Louis is a classic example. Philadelphia wasn't willing to cancel the parade, and within weeks, untold horror in the streets of Philadelphia. St. Louis was willing to cancel and clamp down, and they fared much better. Stories like that. Those are pretty durable teaching points. Vaccination will help bend that curve in a substantial way.
Well, my understanding during the previous pandemic, that mask wearing was a controversial issue, not a political issue, but a controversial issue, even then.
Yeah,
It was
even
almost
then,
like deja
sure.
vu.
Yeah, right. Humans are still humans. Don't like to be told to do certain things. It seems so personal, right? So immunization, we live in the day of vaccines. Certainly the days of genetically figuring out this new pathogen very promptly. So testing. So testing was new with this pandemic, coming to scale so quickly, and still doesn't feel like enough. It'll be interesting, I think, 5 years from now to see the discussion regarding the placement of testing in all this. Immunization and bringing that to scale is in distributing the vaccine is of great concern to everybody. And there's a phased approach, starting with frontline workers, which I think will be occurring before the end of December. General population probably later, and I think the current playbook includes lots of venues of delivering the vaccine by the spring. It would not be just a certain number of health departments, hospitals, or community testing sites. I think using, in the state of Indiana, this community testing site motif is a real opportunity. And I believe, from what I had heard, thinkers at the State Department of Health have been strongly considering your role in allocating vaccine. I don't know details of that. The drive-through approach, boy, I tell you, that is a lot more efficient than an office visit, 15 minutes by 15 minutes, right? We need to have a product that will allow that. The early products have just a cumbersome cold storage requirement and a 2-dose strategy. So there are some encumbrances early, but I think more products are in the pipeline. And we'll see what's available when it comes time to immunizing the general population. I think the health department being an immunization site, we're like phase 2, I think. And that's where I think if we can come along tandem with you at the community testing site and get vaccine for you, get vaccine for us at the health department, I think it's going to really be all hands on deck as much as we can with this. A good smorgasbord flows best when you have lots of serving lines, and I think we need to think that way with mass immunization. I was part of the H1N1 mass immunization thing, and one of my most memorable images is the line snaking outside the door of our K21 pavilion onto the street as people waited in line. Whenever I see that image, I think that was such bad strategy. You need more serving lines. We need lots of hands on deck with this. So hopefully we'll have that here in a few weeks. Thanks for your willingness to participate in that. It's all about procuring the vaccine, of course, which will be flowing from the State Department of Health, and allocation is not perfectly clear, at least in my mind, how that'll work.
Yeah,
So it'll come in a hurry once it comes, I think.
Yeah, in simplicity, having to mix it and.
Right.
Yeah,
Yeah, but your point is well taken. Yeah.
Yeah, and just to add a little bit to that conversation about the vaccine and the distribution of that, I know we just got a note from our fire territory that fire stations are being asked to be considered as vaccination sites as well. Mm-hmm. So I think the distribution, depending on which of the vaccines, is it the one that needs to be frozen and thawed and used within 30 minutes and given twice, or, you know, it'll be interesting to see how that plays out. But I know that, again, thankfully our organization in this county is such that we'll figure it out. And I know that's the one positive from this pandemic. Two positives I take are that this community is obviously coming together in many, many different ways. The second thing is I've been really surprised at how kids are wearing masks. And I was hearing a lot of skepticism and pessimism about their ability to wear masks, and I'm amazed at how kids are taking to that. So maybe we can all take lessons from that as well. So I've got some questions here. David, since you were first here and in person, I'll give you the first shot.
Okay. Well,
Is that microphone on? It's not.
I can test loudly if that'll.
Let's turn it on because I want everybody to hear it. Sorry about that. That should have been on. It'll just take a second. There you go. Thank you.
I think my first question is for Dr. Remington, maybe both of them. Obviously, with Thanksgiving comes Black Friday and shopping, and a lot of stores aren't doing that this year, but some may still, and some people may still go shopping. I guess, what's your advice, and would you recommend people don't go shopping Friday, or what would your advice, I guess, for Black Friday?
Yeah, I think great caution with Black Friday, and try to avoid stepping into a very crowded store if you can. Businesses should look at creative ways to capture their clientele on that day. If you are of age or have risk factors that have been proven to be a problem with COVID, weight, diabetes, complex health issues, please don't go shopping on a crowded shopping day or any crowded store. Go at a quiet time to shop. Support the local businesses, certainly, but let's all find a creative way to do that. Avoid a crowd. Crowd, duration, size of space, mask wearing, all fold in thinking of how we try to mitigate, slow down the spread of this efficiently spread respiratory virus. It loves crowds, loves the absence of masks, loves loud voices and laughing and singing, and loves people hanging together for some duration in a closed space. So break all that up. Don't become a contact. Don't become a case.
And then, correct me if I'm wrong on any of this, but when you're little, you have to get the shot for chicken pox. And now a lot of people are getting side effects with shingles. I think they're connected. And a lot of people I'm talking to are concerned about similar side effects to this vaccine because it's came out so quickly, in testing. Is there any, what would you say to people concerned about getting the vaccine because of long-term side effects?
So the virus that causes chickenpox and shingles is the same. The vaccine used to prevent it is an attenuated live virus vaccine. So, it'd be an outside chance you could maybe get a little case of chickenpox from the vaccine, which years later would allow you to express shingles. Shingles is re-expression of your smoldering chickenpox that you never get rid of. So the vaccine products that are in the pipeline that I have heard about with COVID, I have not heard of a live virus, attenuated live virus vaccine. I may stand corrected if someone has heard of one, but at least the first two products that are coming are not that. First three products I've heard about are not that. We'll all want to be wise with any vaccine, but I will line up as soon as I'm eligible to get the vaccine. And I would encourage the population to be willing to be immunized. Be smart about it. Certainly be smart about it.
Okay.
I think that's it for now, but
All right. Oh, I'm sure we got some time here. So Nick Duranick from radio station 1480 News Now had written a few questions. I'll read them. We might have already touched on them, but if you want to focus a little bit, again, to you, Dr. Remington, number one, I've received a number of times in recent weeks from listeners this concern, but in your professional opinion, do you know of anything positive that might be seen on the horizon, perhaps vaccine aside? And I don't know if he's talking about some of the treatments or maybe the case counts, just anything that people can look to. I think his concern in the body of this note was that, people are really getting, as you suggest, pandemic weary, and we need that light at the end of the tunnel. And I think, you've discussed the vaccine. Are there any other things that you can give our viewers that little bit of a ray of hope?
Well, I'd say the ray of hope is, number one, I thought of, like Kurt, what to be thankful for. What I am very thankful for with this pandemic is that it's not an influenza pandemic. It's not taking out young people. Think of the emotion if we were seeing children and young, healthy adults dropping out with this. It'd be horrible. It's bad enough seeing disproportionate loss of aged patients, but just imagine if this was taking out our kids. That'd be horrible. The ray of hope is there still is something you can do about this, and that is to try all these things that we're encouraging, the social distancing, the masking. And the ray of hope is that we now know a lot about this virus, and it still remains the vast majority of people who become infected with this virus survive and do well. They're beat up, they're tired, they got a cough, they're frightened sometimes by how sick they felt, but they recover. And I love to hear those stories. I've been hearing stories like that in my personal conversations with patients this week. They get better. They really respected how ill they were, though. So the ray of hope is that we have bodies that largely do get over this. There are therapeutics on the horizon. Nothing is standing strong for everybody with an outpatient case of COVID. There are some vitamin supplements thrown around. Nothing's been proven. Antibiotics empirically, that's usually discouraged. The inhaled steroids really didn't pan out in the best of the medical literature, but yet still people strongly propose that. But there are some strong therapeutics coming. Like I mentioned, the monoclonal antibody cocktail is promising. It'll have limited application, of course, and be very expensive, I'm sure. Although the feds will be picking up the cost of that on a patient-by-patient basis. And the vaccine is coming. My goodness, that Operation Warp Speed really cranked out novel vaccine and products here. And they'll be safely vetted. They will be. There's a tremendous industry and governmental engine at play there. Be patient. Just a huge task to ramp that up to production and distribute it. It seems like it won't come quick enough, but it is coming, and I'd say that is a real bright spot on the horizon.
And this is probably a question that we all been scratching our heads about, but and for those that still believe the virus is fake or nothing to be worried about, what do you say to the folks that have been saying that has not already been said? Is there any way to make it finally sink in?
Yeah, I don't know how to do that. I can say the person who asked that question has been blessed that they have not had a personal experience with it, either in their own health or within their family circle. But at the rate the cases are growing, that subset's getting smaller and smaller of the population.
All right.
I have a couple questions for Kurt.
I got one more and then I'm back to you.
Gotcha.
Dan Spalding from Ink Free asks, what exactly will health officials be looking for when visiting businesses?
Masking and social distancing quickly come to mind.
And those, obviously, were in the governor's executive order, the
Right.
6 feet distance
Yeah,
between
yeah,
patrons.
it's just
Yeah.
all playing off the governor's executive order. So you can go online and find that. That's our playbook. Nothing weaker, nothing stronger. That's our playbook. And we'll work with you, but we really need people to help us out here.
Thank you. All right, Mr. Sloan from the Times Union.
Gotcha. Hey, Kurt, now that you guys are at the fairgrounds, do you know how long the testing site will remain there? And any new update on the second site? Or I know there was money for a second site. Will that just be moved into the first site, or will there be a second site? Or
Good questions. My original plan was to have a second site that was mobile, but we did not anticipate this volume. When the state's guidelines first I got, they anticipated 100 people a day, and you could do that with 3 staff, 2 taking data and 1 doing the swabs. We blew that out of the water immediately. We had 102 our first day, and then it's just grown ever since then. So I didn't think that the original funding for the first site was going to in any way cover the cost, because I've got as many as a dozen people working out there now. And I appreciate that the county has, and the Ford Board has generously allowed us to use the Shrine Building without cost. It is just going to go up from there. So Bob Weaver has gotten county support and submitted to the Department of Health at the state level to use that second distribution of money or allocation of money to fund this site. So it's really, we're doing the work of two sites. I think we should recognize that and have the money flow to support this site.
So what about residents in maybe the north and south part of the counties who maybe are low income, can't travel, or the winter's here, the roads are bad, but they feel sick? I mean, I guess if the site's central, I mean, I get it, it's central, but not everyone can make it to.
Yeah, I absolutely agree, and you've just stimulated my guilt, because I truly did want to be up there and readily available, but it's just not feasible given the volume that we're seeing locally, and there's just not enough dollars.
Is there any indication more dollars will come after the new year?
I don't know, actually. The health department might have a better read on that than I do. I've not heard of any more coming, other than each county was based on their population, and Kosciuszko County qualified for 2 sites, and others more and some less. But
So the CARES Act funding federally, allocates that money into all different pots, and certainly testing is a part of that. There's talk that there may be a second CARES Act stimulus package come along that could potentially address that. I know the CARES Act dollars that we've utilized to supplement testing, and we had a clinic up in Syracuse. Actually, we still do offer CARES Act testing up there till the end of the month. So that still is available in the north up there. But, those dollars have to be spent by the end of the year. So I would anticipate that we might get some more allocation and or at least get that testing beefed up. That's just maybe a wish. I know with the vaccine distribution maybe being the larger issue at hand, they'll be pivoting more towards that. But at least I think we've done our part to spread it out in somewhat of a rural health area. At least still having this central great site that's accessible is good. I know the turnaround time has been a problem, and that's just a problem everywhere because the labs that these tests have to go off to are, you think we got lines in this community, we got lines in every community, and these labs are pretty much having to get through that backlog of testing. So, it's just we're being overrun right now with the cases and the demand for testing. And I think we're doing as good a job as we can. Obviously we can always do better, but Kurt kind of says it's like everything else kind of comes down to the dollars and being able to get that done. But again, I will remind you that there is CARES Act testing at Syracuse MedStat and the Warsaw MedStat and Parkview and the Napanee MedStat through the end of this month, which is probably for about another week.
And June was supposed to be the end of this cycle, and I've not heard anything beyond that, but my presumption is that we're still going to need to be doing testing well beyond that.
And then mental health. Has Bowen Center seen any increase? Guessing it is, and mental health issues related to COVID, or
yes,
what's going on with the mental health of the community, I guess?
Yeah, in fact, interestingly, we have student assistance programs with many schools. And it's to provide prepaid services that the individual child or family can access. And we've seen more than a 30%, and I don't have the exact number here, but more than a 30% increase in the use of that since before the pandemic. And interesting, employee assistance programs, so we have that with many organizations, I think even including the city. We've seen not quite as much of an increase. It's been more like a 10 to 15% increase, but that's gone up. And the number of schools that have requested as many as 1 or 2 year long contracts for the student assistance program has just dramatically accelerated. So the further out Bowen Center goes, the more schools are interested in the model that we provide, home-based, school-based services, community-based services. And so, yes.
In the long run, will that become a funding issue for the Bowen Center, or you?
We have the good fortune of continuing to grow. Our talent acquisition team has been very successful. There are a lot of organizations of our type that can't find employees, and we continue to have employees come to work for us, willing, eager to do the work.
All right,
That's all I got.
okay. Dr. Remington, any final thoughts? Okay,
We'll get through it.
yeah.
We'll get through it.
Trying to read your facial expressions behind that mask, so you say a lot with your eyes, and we certainly appreciate your wisdom here and guidance. It's been, from day one, it's been great. I'd like to echo Kurt's Thanksgiving wishes out to everyone, and very much appreciative for the way our community has responded to this. You know, we're all, always very cliche, we're all in this together, but I feel for the most part this community has gotten it. Is doing a great job, and those that have the ability to help others are helping others, and I always appreciate that. We'll be back 2 weeks from today. If there's a change in our status, we could potentially be back next Wednesday. We'll wait and see how that plays out, but for now, we'll come back in 2 weeks for the next press conference. So thank you all. Have a safe holiday, and enjoy your food. Thank you. All right.
Thank you. Kurt, thank you so much. We need to lobby for more money